Welcome to Renus Care Radio, a podcast dedicated to topics of interest to the kidney care professionals. In today's episode, we'll provide an overview of glomerular proteinuria and will unpack its mechanisms, implications, and management strategies. Proteinuria, characterized by the presence of excess proteins in the urine, is commonly associated with renal pathologies affecting the kidney's glomerular structures. This episode delves into the pathophysiology of glomerular proteinuria, discusses its clinical implications, and explores management strategies. Glomerular proteinuria arises when there is damage to the glomerular filtration barrier, GFB, a complex structure that typically prevents large molecules such as proteins from leaking into the urine. This barrier includes endothelial cells, the glomerular basement membrane, GBM, and podocytes. Damage to these components can occur due to various conditions like glomerulonephritis or diabetes, leading to structural changes or functional alterations that increase the permeability to proteins, especially albumin. Additionally, hypertension can exacerbate this condition by increasing glomerular pressure, thereby forcing proteins through the filtration barrier. The detection of protein in urine serves not only as a marker of kidney damage but also as a prognostic indicator for the progression of renal diseases. Significant consequences of glomerular proteinuria include the potential progression to chronic kidney disease, an increased risk of cardiovascular conditions such as hypertension and heart failure, and the possibility of developing nephrotic syndrome, which features symptoms like edema, hypoalbuminemia, and hyperlipidemia. The diagnosis of glomerular proteinuria integrates clinical assessment with specific urine tests and, occasionally, kidney biopsy. Clinicians commonly use the urine protein-creatinine ratio, UPCR, and 24-hour urine collection to quantify protein excretion and evaluate the severity of proteinuria. In cases where the specific type of glomerular disease needs clarification or confirmation, a kidney biopsy might be conducted. Managing glomerular proteinuria involves addressing the underlying disease mechanism and mitigating protein excretion to decelerate kidney damage. Effective management includes controlling blood pressure with antihypertensive medications such as ACE inhibitors or angiotensin receptor blockers, ARBs, which have shown efficacy in reducing proteinuria and slowing kidney disease progression. Dietary modifications, such as adopting a low-protein and low-salt diet, are recommended to lessen kidney strain and manage hypertension. For diabetic patients, maintaining optimal glycemic control is vital to prevent further damage to the glomeruli. Regular monitoring of kidney function and proteinuria levels is crucial for assessing treatment effectiveness and adjusting therapeutic strategies as needed. Glomerular proteinuria is a significant medical concern that necessitates timely and accurate diagnosis and management to prevent serious health outcomes. By understanding the underlying mechanisms of protein leakage into the urine, medical professionals can better tailor treatments to the specific causes, significantly reducing the impact of kidney disease. Thank you again for joining us here on Renus Care Radio.